This video is going to look at another psychological therapy for schizophrenia called family. Family therapy takes place with the whole family rather than just the individual schizophrenic patient. And it's based on the idea that some therapists see family as the cause of schizophrenia. If you think back to the psychological explanations, we looked at double blind, we looked at the schizophrenogenic mother. So some theorists do see the family as the main cause of schizophrenia, and that's where family therapy actually originates from. And what it does, it aims to improve the communication and interaction between members of the family, with an aim to reduce any stress in the family, reduce the expressed emotion that could contribute to a schizophrenic individual relapsing back into hospital. And that's the whole point, okay? We're trying to reduce those expressed emotions, that volatile and hostile environment in the home to help reduce the symptoms of schizophrenia. So family therapy aims to reduce and use a range of strategies to try and improve family functioning. I'm going to give you quite a few of these. You won't have to name them all in exam. Try and remember the best three that you possibly can maybe to get into an exam. As long as you can expand on them, that should be enough. So the first thing they'll do is try and do something called psychoeducation, where they help families understand the illness, understand how to deal with the illness that little bit better. They try and educate them about the psychology, so psychoeducation, of schizophrenia. They try and reduce the stress of caring for a patient, so giving families little strategies, little tips on how to help care for their schizophrenic family member. They try and reduce any anger and guilt in the family. A lot of people, when especially talking about expressed emotions, will feel anger, will feel very hostile towards that schizophrenic individual. And this therapy tries to reduce all that anger, try and get to the root of it, to help them understand that having those high levels of anger won't benefit the individual. It's about helping family members achieve a balance between caring for their schizophrenic family member and also maintaining their own lives, because getting that balance can be really difficult. A lot of families will spend the vast majority of their time looking after the schizophrenic individual, whereas they need to try and get a balance between that and their own life. Otherwise, it's only going to increase things like anger, hostility, and stress within the family. It's about helping the family try and anticipate any problems. When can they trying to identify when someone's starting to show maybe their hallucinations, their delusions, an increase in the severity of their symptoms. It's about giving the families the strategies and the knowledge to anticipate any problems before they occur. And overall, it's about improving the relationship within the whole family, within the household. And it's getting those families to start listening and discussing with the schizophrenic patient, rather than just talking at them and telling them what to do. About listening and discussing any issues that they may have. So like I said, these are a range of different things and a range of different strategies that family therapy will give to the family. You won't have to remember them all, just try and remember a few of them in good detail. So family therapy is often used in conjunction with drug therapy. And it's all based on that principle that schizophrenics in high EE families, so high expressed emotion families, have a higher chance of relapse and ending back in a psychiatric ward and hospital. So this whole therapy aims to increase the family's tolerance and reduce any negative attitudes that they're going to have towards that schizophrenic family member.